Hello, my name's Dr. Lonnie Treese, and I'm with Willow Tree Counseling in Seattle, Washington. In this video, I'm going to talk about how I use EMDR, which is eye movement desensitization and reprocessing, as a therapy tool, primarily for trauma. And I can refer you to the website emdria.org, emdria.org, for more information and lots of research and general information about EMDR. So I've been trained in it since 1998, and there's a lot of people trained in EMDR and have been over the years, and I just want to say there's a lot of different ways that people kind of tailor it and do it in their own unique way. So I'm going to be describing how I have been using it, and I find it very effective and helpful for my patients, especially with trauma. It is definitely one of the best, arguably the best treatment for trauma. There's some reasons for that. One reason is that it's holistic, and the therapist will be monitoring the whole person, not just their memory and their thoughts and what they're saying verbally, but also how they're feeling in their emotions, as their emotions shift and change as they process it, and also how they feel in their body, noticing where they're feeling things in their body and how that might be shifting and changing. It's also very efficient. This is a quality about EMDR a lot of people have heard about, and it is true. It is very fast acting. I would say you can get done in one session of EMDR what would take 4, 5, or 6 sessions of talk therapy. Depending on how complex the trauma is, you might be able to get through a whole trauma in just one session, which is phenomenal. So it's very efficient, but I will talk about the downside of that in just a second. It's very effective at getting around defenses. I've seen people come in pretty defended in different ways as they're approaching just talking about the trauma that happened, but when they do EMDR, it seems like those guards drop, defenses become softer, and the mind can just start processing like it's meant to do. It's a very hands-off technique. We're just letting the mind do what it needs to do to get unstuck. And the other thing that's efficient about it is I call it like a spillover effect. So imagine that, let's say you have different themes of trauma, like the trauma from my father and the trauma from schooling. And imagine that your brain and how it stores memory is kind of like a file folder for documents. And so there's a file folder with a lot of different files in it, or memories that's labeled father, and then a different file folder labeled school. So when we go in on a father-related memory, it heals that memory, and it will have a spillover effect to everything else that's in the same folder as itself. And so then we go to the next father memory, and already it's doing a lot better. And that's because it has that kind of spillover effect in a really good way to other related memories. Another good reason for EMDR is it has really long-lasting success. It's what we call low recidivism rate, which means very low rate of regressing back to how upsetting it was before. So there are some scales. I'll talk about that in just a second. And we can check on the scales both at the end of the session and a few weeks later, and even like a year later, and rate the trauma and see if it's holding. And the research has shown, and my own experience since 1998, and it's now 2022. So very, very low recidivism rate. It tends to hold forever, the work that gets done with EMDR, so it's great. Okay, the downside of all that and how efficient it is and strong it is that it is what I would call an intense form of therapy. It can be very emotional, and I advise people that they schedule their appointment in such a way that they don't have to just rush right off to work or something like that. They can actually debrief it in their car, journal it, think about it, and just relax before doing anything else big that day. So it can be pretty intense. And now I'm going to talk about how it works. So it's got a whole setup to it, and we would have already talked about your different traumas that you want to work on. And we pick one, and it's called a target, but it's basically a traumatic memory. And then we discuss it, and we come up with the SUDS rating, that's subjective units of distress. So how upsetting is this memory to you now, not back when it happened, but even now, from 0 to 10. We generally tend to work with memories that are about 6 and above. The lower memories, you know, they might have been horrible at the time, but if they're not troubling you now, we don't need to go back and look at those. We just really want to look at memories that are still affecting the person. It's still very upsetting even now. And so you rate the upset level. You can identify the negative cognitions that are still attached to it, like I am powerless, I'm not lovable, I'm not worthy, something like that. And then we figure out what the positive cognition would be, which is usually the opposite of the negative cognition, like I now have choices, I am lovable, I am worthy. And then you rate how true you believe the positive cognition, from 1 is totally false to 7 is totally true. And what we're looking for is movement in that first scale to get less, and in the second scale to go up. And that also helps us see, like, you know, what's getting in the way of it being a 7 for the positive cognition. Then we can focus in on that. So it kind of guides the session as we go along. And then I ask you what you're feeling emotionally right now as we're about to talk about it and use EMDR. And a lot of times people say they feel anxious or sad. And then I ask you how you're feeling in your body right now. And sometimes people say nothing because they haven't quite, you know, gone into it yet for it to feel anything, or they're kind of numbed out. Some people do say numbed out. That's actually a feeling too. They might just say, I feel tight in my chest, or I feel like tears behind my eyes, or something like that. Then we have that whole setup, and then we do bilateral stimulation, which means alternating left and right. And that can be eye movement, which your eyes go back and forth, left and right. It can be listening to tones or music, alternating left and right, or it can be holding what I call tappers in your hands that vibrate back and forth, left and right. I'm going to show in a different video my equipment for all of that, so you can see what that looks like. And so then we're just usually quiet. Sometimes the person talks while the bilateral stimulation is happening. That's fine. They can talk or not talk. It doesn't matter to me. But there will be a period of bilateral stimulation while they're thinking about the memory, the negative cognition, their emotions, and their body, and just noticing it with no judgment. And then we pause it after a while, and I ask what came up, and they say what they noticed. So usually the memory starts to move, they start to remember different things about it, or they feel something different shift in their body, or they feel their emotion shift, or all of the above. Sometimes their brain goes in kind of a tangent, and again, there's no judgment. That probably means the brain needs to do that in order to fully process the original target. But I'm there as a trained clinician to help, you know, keep things on track, keep it moving, and use my best judgment on, you know, if we're getting kind of down a rabbit hole, or if it seems to be productive. So then the brain is basically weaving that information through the left hemisphere and the right hemisphere, left, right, left, right, left, right, through that bilateral stimulation. The left hemisphere tends to be more verbal and analytical, and the right hemisphere is more emotional and spatial and creative. And often in talk therapy, we're mostly just engaging the left brain, and all those defenses are kind of keeping us from fully engaging the right brain. So this is very effective for letting your brain use its whole self in processing the event, so that you can get whole healing as well. And basically what I've seen over all these years is that EMDR allows the person to have a feeling of perspective. So think of it this way: if you had an eye surgery and you have to wear an eye patch, the doctor will tell you that as long as you're wearing an eye patch, you can't drive. And that's because you need both eyes for a sense of depth perception. The left eye is seeing what's ahead of you on the road slightly different from the right eye. The brain is linking that all up in a way to understand depth perception. So think of it like that with your left hemisphere and your right hemisphere. You need both working together to be able to finally see that event as, yeah, it was a terrible, horrible thing when it happened, but now with perspective, I see it happened a long time ago and I'm okay now. It helps you to not feel so frozen. You probably know that when a trauma happens, you can feel fight, flight, or freeze. And basically the trauma can get stuck or frozen in the brain, and it doesn't, your brain's trying to get through it, like with nightmares and things like that, but it's still stuck or frozen. So EMDR is a good way to unfreeze it. Also, a good thing about it being holistic with the physical part and your body is we're checking in on your body. And sometimes people, especially if they've been through like an assault type experience, they froze and they didn't move their body, and their body still holds that. You might have heard about this from The Body Keeps the Score by Bessel van der Kolk, but the body has a need to finally move. And so we allow that also in a session. Is if you want to hit a pillow, hit the pillow on your lap. You can even push on me in my rolling chair, with probably a pillow between us, so you're not pushing me per se, but it gives you finally that release of your body's able to move like you really wish you could have. So EMDR is normally done in person, and like I said, in just a second, I'm going to show you my machine I use. It can be done through telehealth. I don't prefer to do that for many reasons. A person, like I told you, can be intense. They can get reactive. They could even start dissociating. And it's best if I'm here in the room with them to help them with that. I can typically see when that's happening. I actually have a little bottle of lavender oil here that people can smell. It's very strong. The olfactory sense can really bring a person back into their body. Other therapists use other things like coffee beans, stuff like that. So we have ways to help you get back to your body, take a break, do some breathing, maybe even stop the EMDR for that day. Whereas if you're in your house, you could just get dissociated and you might not be listening to me anymore, and then you're stuck and you're miles away from me, and it's not a good situation. So I do prefer to do it in person. That being said, I have done EMDR through telehealth, typically with like Spotify EMDR music that the person is listening to. But those are people that I've already worked with a lot, and I already know quite a bit about them, and perhaps we've already worked through the worst of the worst, and we're just doing kind of more milder work. So for reasons we felt it was safe, and it has worked out with those people. So there is a time and a place where you probably could do it through telehealth. It is useful for what we call big T trauma. That's like really horrible stuff, like witnessing someone dying, yourself almost dying, rape, child abuse, really bad stuff. It's also useful for little T trauma, which would be things like getting humiliated or embarrassed or shamed. Just anything that's maybe not as dramatic as what we would call a capital T trauma. And it's useful for things at any point in your life, from your distant past to recent. You really probably should have at least some of a real memory, even a fragment of a memory, not just something someone told you happened to you. And this does work on children. There's a whole group of therapists out there that see kids. I don't tend to see children, but it does work well, regardless of your age. It's not meant to uncover repressed memories. That being said, sometimes that happens. It's kind of like a side effect that while working through the trauma, other aspects do float up to the surface. I would say that happens about 25% of the time. Again, it's not our purpose for doing it, but it typically is a relief when that happens for people, that they get a bigger picture of what happened in the past. It can also be useful for things other than trauma, like loss, phobias, panic attacks. It's been used in substance abuse recovery, just a variety of things. So that's all I have to say about EMDR, and in my next video I will show you the machine.